Hello, I'm Jorge Gestoso. Join me on a new program with the COV-Iran Barakat vaccine, the new vaccine developed by Iran against the coronavirus, with an outstanding guest, Dr. Ehsan Mohebi, directly from Tehran. Dr. Ehsan Mohebi, a warm welcome to the program.
Thank you for having me.
Dr. Mohebi, tell us how difficult was to develop your own vaccine against COVID-19 that you call it COV-Iran Barakat.
First of all, thank you for having me. If I were to list all the sanctions that the United States has imposed on us, I think it might be more numerous than all the sanctions the United States has imposed on others. About the coronavirus vaccine, I should tell you about the early days of this pandemic all around the world. I can remember that that time in early corona, the United States blocked any money we had to buy hospital equipment abroad. They didn't even allow a mask or a ventilator to Iran have that, and what they did, and I don't want to go to the details, is a real economic terrorism. As you know, terrorism is not just about killing the innocent people in a country, which of course some countries are expert on that, especially the United States. There is another type of terrorism, more dangerous, more inhumane, and more barbaric kind of terrorism. They call that maximum pressure, or economic terrorism, or crippling sanctions, they call that. With this, along all of these heavy sanctions and limitations, we have tried hard to believe in our internal capacity. We believed in our young scientists, and we finally reached this great achievement about creating and producing the coronavirus vaccine that we call that COV-Iran Barakat. COV is an abbreviation for corona, COVID. Well, that was a very long way and a hard way, of course, to reach this technology. But all of this effort, we were able to join the group of 6 vaccine creators in the world. The 6 countries before us had this technology and ability, and we joined this group. And also, if I want to tell more clearly, coronavirus ravaged the world, sparing no nation. Even the world's largest economies need others to help it to fight the pandemic. During the coronavirus, we had only this way to have our own homemade vaccine, and finally we did it.
So, Dr. Mohebi, just explain to us some characteristics of the vaccine. Let's talking about the level of effectiveness, the percentage, if it's 1 or 2 doses, if it's how it's reacting to the different variants. When did you start to apply the vaccine to the population? Tell us about all that, please.
As you know, measuring the effectiveness of any vaccine requires the passage of time. It needs time. And the numbers announced by news agencies about the effectiveness of various vaccines are based on initial estimates and evaluations, or based on early clinical trial results, and should be evaluated in next future. But about our vaccine, I think we should let the scientists announce about that. But the number I know is over 93% that this result came from scientific laboratories and clinical trial. This vaccine has 2 doses, and this technology is about the inactivated virus. Of course, we are launching 6 vaccine production platforms, and COV-Iran Barakat is just one of those 6 platforms that they have achieved sooner. This vaccine has been approved by our Ministry of Health and has successfully completed the 3rd phase of clinical trial, and scientific documents of this vaccine about from the beginning to now, from the pre-phase 1 to the end of the phase 3 is now available, and you can have the full access to that.
In the case of the situation in Iran, your president Rouhani was on TV this weekend and say that there's concern about the variant, the Delta variant, because it's all over the world, really gaining momentum. Also in Iran, is your vaccine effective against that Delta variant?
The result of clinical and laboratory tests show that it is effective against African and Indian variants and some other variants. I'm not want to say something. It was very correctly, fully correct and true. We should give it time to have the final answer. But as I said before, the result of clinical and laboratory tests show that it's effective against African and Indian variant. But we will announce the final opinion as soon as the scientific reports are finalized.
Why you were saying that it's very important that the maximum leader of your country, Ayatollah Khamenei, was being vaccinated with this new vaccine?
Well, that's a great question. The fact that our supreme leader vaccinated with our own homemade vaccine, I think it has an important lesson and a clear message. And the lesson is that we should not depend on other countries, or our eyes should be on the hand of others. We must believe in our internal capacity and the scientific potential, our young scientists' potential of them. The main lesson that we should reach and try for the independence. In every country, there is great scientific groups and scientific teams, medical teams, for their own leaders and presidents. With the many of the evaluations of the effectiveness of many vaccines, our homemade vaccine and foreign vaccines, they finally believe that there is the best. But our supreme leader from the beginning believed in our internal capacity, and we are so glad that our homemade vaccine passed the checklist of being effective. Of course, as our supreme leader said before, we should help other nations too, and provide the necessary scientific documents to them. And we are not like the group of 7 or other countries that they are only said about the showing off. We won't let any.
Precisely. Regarding the G7 group. What do you think about the global response to the pandemic? For example, the fact that the wealthy countries were having about 93% of all the vaccines produced in the world, that's according to the World Health Organization, and only 0.3% went to the countries less wealthy. There's this organization, this NGO called Oxfam, that they were writing letters precisely to the wealthy countries, saying that in reality what they're doing is practicing health, basically health apartheid. Do you believe it?
You're a wise man, and I love your question. That's a great question. Look, fighting the pandemic requires pragmatism, not slogans. I have already mentioned that even the United States, which considers itself as a superpower, needs the help of others to fight against corona. In a world where not even one country is safe, no one is safe. For someone in group of 7 or G7 to say that we provide 1 billion free vaccines for full countries, but it's just a hoax. It's just a showing off. You should ask African people who have even received 1 dose of the vaccine, have you ever received 1 dose of vaccine? A single dose? They said no. But it doesn't mean that we should leave other countries alone. We should fight against the coronavirus together. Fighting together, we should stand each other. We should have each other's back. And we planned for our mission that to not leave any country alone, and we should have each other's back. But it's very unfortunate. It's such a shame that some countries doesn't help their own allies. You should see and observe the relationship between the United States and Canada. The United States doesn't provide enough vaccine for Canada, and I think we should be more. We should believe in pragmatism. We need pragmatism, not slogans and showing off and some tweets. They are not enough.
And in the case of Iran, Iran is ready to help other countries less or more vulnerable than the wealthy countries in order to get the vaccine. For example, Iran is ready to help Latin America with its COV-Iran Barakat vaccine.
Well, we are friends. We are allies. We should have each other back. We are ready, completely ready. But we should consider this rule that any good action should be done at the right time. And we are looking forward to have mutual cooperation and provide enough vaccine for the other countries, especially the Latin America. And I think we should move quickly and believe in our internal capacity and have each other back. I'm so hopeful for having this bright future for both of the parties.
You were mentioning that this is the development of this vaccine in your country is, you say, a great achievement, and you say not only for Iran, but all for the Middle East, for the Muslim world.
Well, if you let me, I want to quote a poem from one of our great poets, Saadi. He said that, I am quoting, all humans are members of one frame, since all at first from the same essence came. When the time afflicts a limb with the pain, the other limbs cannot at rest remain. If you feel not for others' misery, a human being is not a name for thee. This achievement, as I said before, as a great achievement, and you are so kind to mentioning that. I said that because the, those heavy sanctions, as I mentioned before, with those crippling sanctions that they have affected in everyone, especially Iran, and with the time that I mentioned that they didn't even allow us to have a mask, to have just a ventilator, to have just a simple cooperation with others, to reach the scientific journals. They didn't let us that. We believed and we didn't give up. We moved on. And this is a great achievement for all human mankind, not just only Iran and not about the Islamic world. It's about for others. And it's such an honor for us in Iran and also the Islamic world. The fact that you could resist a superpower and not fail. It's very important. And we are looking forward to help other countries, especially the Latin America, with the lovely people of the Latin America. We are friends. We look for bright future for both of us, and we should have each other back.
Precisely, you have said that the main lesson of countries under those heavy sanctions that you were mentioning that the US was applying for about 40 years to Iran is never to give up and develop your own capabilities.
I don't want to say about some, inspirement quotes, spiral quotes that say don't about the success and in various subjects. As you said, I think this is the most lesson for many subjects for life that we proved in creating and producing vaccine. The main lesson is don't ever give up. Move on. Go ahead. If there's a limitation, also there is some capacities. If there is a limitation, there is also opportunities. You should believe in yourself. I think there is a great capacities in Latin America. Great people, great scientists, also like Iran. There is not only a there is not a. Sorry.
No, what I'm saying is that there is that synergy. There is some joint work together. Your scientists with the Cuban scientists that they have developed the Soberana vaccine that you were renamed in Iran the Pasteur vaccine.
This is another example. As an example for how the great cooperation can work, how having each other's back could work, how pragmatism could fight against the corona, not the slogans. And it's just a sample. We should make it happen for other countries and make other cooperations and other examples. I think the corona taught to all of us that we should be careful about the promises that some countries like Group of Seven promise to another countries. For example, they said that we should provide $1 billion, as I said before already. They said that we can provide 1 billion vaccine, but it is given just a single dose. This example that I said and you mentioned before should be done in other subjects, and I'm looking forward to having that.
Any idea of number of Iranians that has already been vaccinated with the COV-Iran Barakat and plans in the country to have the full population, the about 40, you are about 84 million people. Most of the people that need to be vaccinated, when could be eventually what plans are to do that job?
Well, we plan to vaccinate millions of our own people with this homemade vaccine. We have given several parts of these vaccines in the weeks since the legal permissions were issued by the Ministry of Health. To precise, if you allow the numbers to be announced by our Ministry of Health officially, but in this way, in the future, along our vaccination, we will. I hope we will provide these vaccines for other countries, and also we should. I said we should start scientific cooperation with Latin America to provide this vaccine and transmitting the technology.
So you were mentioning in this interview that there are other vaccines in the developing phases. You were mentioning 6. Tell us a little bit about that.
Yes, there's very many technologies, many platforms to producing a vaccine, and COV-Iran Barakat is just one of them. We have many vaccines that they are developing and they are in a clinical trial. But COV-Iran Barakat is the first vaccine, Iranian-made vaccine that passed the 3rd phase of clinical trial and had the permission of our Ministry of Health. And we are negotiating with WHO, World Health Organization, to be in the EUL, Emergency Usage List.
In the case of going back to, you said, the effect of the sanctions in the development of the vaccines, the issues start with what? Difficulties to access to the raw materials, even the test kits. At what point and which phase difficulties become really an issue?
Well, limitations that the United States legitimate sanctions they made for us and have they want to create some obstacles in our way, but I want to clearly say that we did it. I always said before that the main lesson that we should never give up. I don't say about some slogans. I said about the pragmatism. I have seen my co-workers, laboratories, they're working hard. They've worked hard 24 hours a day, all days of the week. They've worked hard for achieving this achievement. I think it's the worst of that. It worsens, and for sanctions, the only this is not only Iran in the United States sanction list. There's other countries too, especially countries in the Latin America, in the Middle East. The countries they are fought against the bullying of the United States about the lateral actions of the United States, about the sanctions of the United States, and we should have each other's back. And we are looking forward to have a great and soon cooperation with those countries. But sanctions could help us to really, not just as a slogan, really, not as a slogan, to believe. Believe means that you should provide, you should focus, you should trust in your own scientists, your own capacities. And that's, I think, very important lesson for all of us.
Do the Iranians have to pay to get vaccinated with your vaccine?
It's completely free. It's completely free for Iranians.
And that is part of your healthcare policy towards people.
The vaccination for all of the people, is completely free, and the healthcare program plan to cover all of the people, our whole population, in next few months with this vaccine and other homemade vaccines, and also other cooperations with vaccines that from our cooperation with other countries.
Dr. Mohebi, finally and last question, what is your hope in terms of turning the page and thinking that the COVID-19 pandemic it's over in Iran? When?
Well, I'm not good at predict because I'm not a prediction, but I think it depends on that how our pragmatism is serious. Well, I don't know about that. Maybe new variants of the coronavirus needs to improve our vaccines technologies as like other vaccines, and because of that, our research and development (R&D) teams are working hard, and the research are continued. But I suppose for answering your question, that I'm hoping that the coronavirus and our full coverage vaccination should be completely done in next 3 months or maybe 4 months, full coverage. But I should announce that very clearly. The exact numbers should be announced by our Minister of Health officially.
Dr. Ehsan Mohebi, thanks very much for joining us from Tehran.
It's such a pleasure for me to be here with you.